Okay, so good day to everyone. This PowerPoint presentation contains information about different laboratory tests that are performed to determine the function of the blood to stop bleeding. So in this slide, we can see the different events or mechanisms that happen after an injury. So the first event is blood vessel constriction. Second is platelet activation, and third event is coagulation. So when there is bleeding as a result of an injury, the blood vessels will constrict to reduce the blood flow, and this will be immediately or simultaneously. The platelets will be activated and they will migrate to the site of bleeding to, to form a so-called hemostatic plug. So again, so the purpose of this is to prevent the uh, bleeding or the hemorrhage. Next, since this platelet plug is not exactly a strong plug, there is a need to reinforce it with uh, fibrin, which is performed by coagulation, so the activation of the coagulation factors. So all of these events will result in a stable hemostatic plug that will prevent further bleeding. This slide shows the coagulation process, one of the events that take place to prevent bleeding or to stop bleeding. We can see that the process of coagulation starts by the activation of either the intrinsic pathway or the extrinsic pathway. Those are the clotting factors in proper order that are activated in the intrinsic pathway. So it starts from clotting factor number 12, 11, then 9, then 8. Then, uh, for extrinsic pathway, it is only clotting factor number 7. You can also see the laboratory tests that are used to evaluate the function of the intrinsic pathway, which is APTP, short for activated partial thromboplastin time. And if you want to evaluate the function of the extrinsic pathway, you can do prothrombin time. So both of these events lead to the activation of the common pathway, which is again evaluated by the laboratory test called TT, short for thrombin time. The common pathway simply is the activation of clotting factor number 10 to clotting factor 10A. So the A there indicates that it is activated. After the activation of factor 10, the next clotting factor that will be activated is prothrombin. Okay, so prothrombin is clotting factor number 2. And then finally, so this will become thrombin. And from thrombin, this will activate fibrinogen, which is clotting factor number 1, to become fibrin. So fibrin is necessary, okay, to form the supporting structure for the platelet plug. The clot that is formed from the platelet plug plus the fibrinogen, activated fibrinogen, is stabilized by clotting factor number 13, okay, resulting in a cross-linked fibrin fibers, okay, with the platelet plug. Primary hemostasis. This process refers to the activation of the platelets as a result of tissue injury. So when there is tissue injury, naturally there will be bleeding. So the blood vessels are damaged, leading to blood seeping out from the blood vessels. So the endothelial cells contain chemical substances that are detected by those platelets that causes them to go to the site of injury. So that is called primary hemostasis. See in this slide the structure of the blood vessels. Yeah, so during an injury, as a form of reflex, the blood vessels undergo constriction. So that is again to prevent bleeding. And since there is damage to the endothelial cells, so the endothelial cells are the cells that line the surface of blood vessels, it will release the substance called endothelin. And this is the one that triggers vasoconstriction. One of the first cells to respond to tissue injury are the platelets. So what happens when they are activated? So they adhere to the surface of the damaged blood vessel. So we call that platelet adhesion. They change in terms of shape. They release certain chemicals, for example, ADP, adenosine diphosphate, that attracts more platelets, and thromboxane, A2. Number 4, they recruit more platelets to make the uh, platelet plug bigger so it can cover a wider area for uh, bleeding prevention. So it results in aggregation, and the resulting structure is then called a hemostatic plug. Next event following primary hemostasis is secondary hemostasis, which is simply the activation of the plasma clotting factors to form fibrin strands. So as we have noted, this process is triggered by the platelets forming the platelet plug. So it will result in a stronger platelet or plug, hemostatic plug, because the platelets itself, the platelets that are attached to the damaged tissue, the damaged blood vessels, they are not strong enough to prevent bleeding. So it requires stronger substance, which is fibrin. The substance that starts or triggers the secondary hemostasis is called tissue factor or thromboplastin. From the platelet plugs, there will be expression of phospholipid complex that attract, okay, or that causes the activation of thrombin. So thrombin, as we know, is formed from the common pathway, resulting in polymerization, so which is stabilization of the blood clot. Okay, and again, this is done by the fibrin stabilizing factor, also known as clotting factor number 13. So please take note of that. You can see in this slide that there is already a change in the nomenclature in terms of how we call the intrinsic and extrinsic pathway. So intrinsic pathway is now known as the contact activation pathway, while the extrinsic pathway is now known as the tissue factor pathway. Anyway, so we have already seen that it is made up of clotting factors. Those clotting factors are generally categorized as inactive enzymes or zymogen. But then later on, they get activated by the previous enzyme. So it's a cascade. So we call it cascade because it's made up of several steps. that once activated, once these steps are, the previous step is activated, it continues until it reaches the last step. So you can see that in those letters, there is a letter A in the subscript indicating that it's already activated. So this is the cascade, the coagulation cascade. So again, we have the intrinsic and the extrinsic pathway. Although we have already changed the name, most people will still use these terms, intrinsic and extrinsic pathway. So it again, the clotting factors that are involved are 12, 11, 9, 8. And for the extrinsic pathway, we have only clotting factor number 7. And both of them, the extrinsic and the extrinsic pathway, leads to the activation of clotting factor number 10, after which it activates prothrombin to form thrombin. Okay, so from prothrombin to thrombin, and this thrombin is again an enzyme needed for fibrinogen to become fibrin. So this is still soft initially, but because of the fibrin stabilizing factor, clotting factor number 13, it becomes hardened. The platelets, the smallest blood cells in the blood, are formed in the bone marrow, resulting from the fragmentation of the largest cells in the bone marrow, the megakaryocytes. They live for about 7 to 10 days, and normally we have about 150 to 400 times 10 to the 9th per liter. So this is the normal count. If there is a decrease in the count of the platelets in the blood, it warrants a problem, a possibility of bleeding. But in one reference, I have seen that for bleeding to occur, it requires, the number should be below 10,000. So even platelet count of about 50,000 still is asymptomatic. So they spend their lifetime, some of their time in the platelets, about 36 hours in the spleen. Okay, so their function, as we have mentioned, they are involved in the formation of the hemostatic plug, and yeah, so they form a complex with the coagulation factors. They have binding sites for fibrinogen, which is called the von Willebrand factor. So, and they have what we call surface platelet antigen. So they are antigenic. That means they can trigger an immune response. Let's talk about the different clotting factors. You can see that they are already listed here. So clotting factor number 1 is fibrinogen. So you know that this is converted later on to fibrin. Then clotting factor number 2 is prothrombin, that is converted to thrombin. Clotting factor number 3 is tissue factor, also known as thromboplastin. Then clotting factor number 4, calcium. So it exists in the form of ions. Clotting factor number 5 is proaxelerin or Lagel factor. There is no more clotting factor number 6 because it is the same as one of the other factors. Then 7, clotting factor 7 is also called the stable factor. You know that this is the only factor that is engaged in the extrinsic pathway. Clotting factor number 8, anti-hemophilic factor. So this is decrease in case of hemophilia. Then 9, clotting factor 9 is Christmas factor. So this is also involved in another type of hemophilia, type B. Then clotting factor 10 is Stewart Prower factor. Then 11 is plasma thromboplastin antecedent. Then 12 is H-man factor. This factor 12 is also known as the glass factor or the contact factor. So this is the one that initiates the intrinsic pathway. Now, the last one, clotting factor number 13, I have been talking about it. This is a fibrin stabilizing factor. And this is also known as the Lackey-Lorand factor, L-A-K-I-L-O-R-A-N-D factor. Right, so this is the last slide. Different tests for hemostasis. The first set of tests are classified as screening tests. So that means that they are initial tests that are performed to determine if there is a problem. For example, we have bleeding time. This is to test for the platelet function and the function of the blood vessels. As we know, normally after bleeding, it should normally stop the bleeding after some time. So that is the basic principle of this bleeding time. Then we have prothrombin time. So this is done in the laboratory to identify if there is a deficiency in certain clotting factors. So prothrombin time, especially for the extrinsic factors. And APTT or activated partial thromboplastin time for that's a test for intrinsic factor. Thrombin time, so this is a measure of both the intrinsic and the extrinsic pathway, including the common pathway. So this is also a test for disseminated intravascular coagulation. Now, if there is any abnormal result in the screening test, we can proceed to specific tests. You can identify deficiencies in specific clotting factors or perform other tests like fibrin degradation products, okay, and D-dimer, so which is also a component of the degradation of the blood clot. So we can also perform platelet function studies like tests for adhesion, tests for aggregation, release, and pathway test. And finally, we have the bone marrow studies. So those are the different tests that we can perform for to determine the function of the blood for hemostasis. So for this presentation, we have talked about the reason for hemostasis. That means that to keep the blood in liquid form, to prevent leakage because of injury. So the functions of the blood vessels, the platelets, and coagulation, so as mechanisms for required for hemostasis. Right, so the process of initiating the blood clotting process, and also the thrombolytic process. We have not actually talked about this, so this will be discussed in another presentation. So, and then the previous slide, we talked about different tests that we use to screen for problems involved in the process of hemostasis. and special tests. So for the clinical significance, so these are the disorders that may be present in case there is an abnormality in the hemostatic test. For example, it could be because of vascular problems, okay, vascular disorders like scurvy. So scurvy is lack of vitamin C. So that results in a problem in wound healing because it affects the function of the collagen. Then there is easy bruising and henox joint length purpura. So this will be discussed in another presentation. We have platelet disorders classified either quantitative or qualitative. So again, this will be discussed in another presentation. Coagulation disorders, as we mentioned, so there may be deficiencies in specific types of clotting factors, or there may be deficiency in vitamin K. As we have mentioned, there are some clotting factors that are dependent on vitamin K, which are factors number 10, 7, 9, and 2. And finally, we have mixed problems. So problems because of deficiencies in certain clotting factors. And we have disseminated intravascular coagulation.